Hi, I'm Kia, and I invite you to Read With Me Medical. Read With Me Medical on this YouTube station, I am going to read off diseases and conditions from the CDC website, the U.S. Centers for Disease Control and Prevention. So I'm going to be reading, everything I read is going to be from the CDC website. And I'm just simply reading off different health topics and different diagnoses and diseases. So today, I'm going to read about Salmonella. Let me go ahead and get to the right page. There's been a lot of outbreaks lately, and so I just figured I'd just read off about the Salmonella infection, Salmonellosis. Salmonella is spelled Salmonella. We're going to go to about. About Salmonella infection. Key points. Salmonella are bacteria, germs, that can make people sick. People can get infected with salmonella after swallowing the bacteria. CDC estimates salmonella causes about 1.35 million infections in the United States every year. Contaminated food is the source for most of these illnesses. Overview. Salmonella are bacteria, germs, that can make people sick with an illness called salmonellosis. People can get infected after swallowing salmonella. Salmonella live in the intestines of people and animals. People can get infected with salmonella in many ways, including eating contaminated food, drinking or having contact with contaminated water, touching animals, animal poop, and the places animals live and roam. Types. Although scientists have identified more than 2,500 Salmonella serotypes, fewer than 100 types cause most human illness. Reminder. This website focuses on the types of salmonella that cause diarrhea. Visit the typhoid fever and paratyphoid fever websites to learn about the types of salmonella that cause those illnesses. People at risk. Anyone can get a salmonella infection, but some groups of people have an increased chance of infection, and some people may become seriously ill. These groups include children who are younger than 5 years, and especially children who are younger than 1 year, adults who are 50 years and older with underlying medical problems such as heart disease, adults who are 65 and older, people who have a weakened immune system, international travelers. Quick facts. Salmonella are a leading cause of food-borne illness, hospitalizations, and deaths in the United States and worldwide. Salmonella are one of the leading causes of food-borne illnesses. Salmonella also are the leading cause of hospitalizations and deaths linked to food-borne illness. Spotlight on chicken. Chicken is a major source of salmonella infection. In fact, more than 1 in every 25 packages of chicken at the grocery store is contaminated with salmonella. Infection is more common in the summer. Warmer weather and unrefrigerated foods create ideal conditions for salmonella to grow. Promptly refrigerate or freeze perishables, foods likely to spoil or go bad quickly, prepared foods, and leftovers. Salmonella causes more infections than you might suspect. CDC estimates that only 1 in every 30 salmonella infection is diagnosed. Why? Most people with food poisoning do not go to a doctor or have a patient sample submitted for laboratory testing, so we never learn what germ made them sick. Antimicrobial resistant salmonella infections are becoming more common. Antimicrobial resistance in salmonella happens when the bacteria develops the ability to defeat the drugs designed to kill them. That means the bacteria are not killed and continue to grow. Resistance to antibiotics is increasing in salmonella, which can limit treatment options for people with severe infections. One way to slow down the development of antimicrobial resistance is by appropriate use of antibiotics in people and animals. Symptoms of salmonella infection. Key points. This website focuses on salmonella that cause diarrhea. Symptoms usually include diarrhea, fever, and stomach cramps. Rarely, salmonella infection can lead to other health problems. Symptoms. Most people with salmonella infection have watery diarrhea that might have blood or mucus, stomach cramps that can be severe. Some people also have headache, nausea, vomiting, loss of appetite, not feeling hungry. Symptoms usually start 6 hours to 6 days after infection and usually last 4 to 7 days. When to talk to your doctor. Call your doctor if you have these symptoms: diarrhea or vomiting lasting more than 2 days, bloody poop, including diarrhea or pee, a fever higher than 102 degrees Fahrenheit, signs of dehydration listed below, long-term complications listed below. What to look for? Dehydration. Dehydration is not having enough fluids in the body. If you have diarrhea or vomiting, be sure to drink plenty of fluids. Do not wait. Dehydration can happen quickly in young children. Give children with diarrhea or vomiting extra fluids such as Pedialyte or oral rehydration salts. Signs of dehydration include little or no peeing, having very dark pee, being very thirsty, having a dry mouth or throat, feeling dizzy or lightheaded, and crying without tears. Complications. Diarrhea lasting a long time. Some people with a salmonella infection might have diarrhea for several months. Infection that spreads to other parts of the body. Sometimes salmonella infection can spread to urine, blood, bones, joints, the brain, or other internal organs, causing symptoms related to that body part or system. Some examples of infection outside the intestines include infection of the blood, bacteremia, infection of the membranes lining the brain and spinal cord, meningitis, infection of the bone, osteomyelitis, infection of a joint, septic arthritis. Some of these infections can have long-lasting effects. Reactive arthritis. A small number of people with salmonella infection develop pain in their joints called reactive arthritis. This condition can last for months or years and can lead to chronic arthritis. People with reactive arthritis may also have irritated eyes and pain while urinating. Reactive arthritis following a salmonella infection is most common among people who are 15 to 35 years old. And that's all I'll read today on salmonella. Thank you for reading with me.